Hi, this is Dr. Shantabanso, electrophysiologist and founder of Atrial Fibrillation Centers of America. Today, I want to try to answer a very important question for you. Why did I get atrial fibrillation? You may be feeling a little sorry for yourself after a few episodes of atrial fibrillation. In addition to this, you may have gone to a few doctors by now and realizing what you're getting into. But I think it's very important to try to better understand what are the risk factors for atrial fibrillation, why you may be getting this. I want to introduce to you Mr. Heart. He's your left atrium. His arms, his legs are the veins that plug into Mr. Heart. And when you're in regular rhythm, he goes along very nicely. But when he's in atrial fibrillation, the top trim of the heart quivers like this, and he's not happy. And today, I'm going to try to explain to you why he's quivering. One of the most common causes is high blood pressure. When you have high blood pressure over many years, it can stretch out Mr. Heart and the left atrium and predispose the left atrium into going to atrial fibrillation. Another cause is aging. As we get older, go from the 40s to the 50s, to the 60s, to the 70s, to the 80s, now all of a sudden you're much more inclined to go into atrial fibrillation. The signal quality within the left atrium, within the heart, degrades with time. That degradation, that scarring of the heart can cause atrial fibrillation. Another important cause is sleep apnea. There have been multiple studies that have linked sleep apnea to atrial fibrillation. Sleep apnea is when the throat closes up when you're sleeping and your oxygenation levels do drop. And also high blood pressure to come out during sleep apnea. All of this in turn brings out atrial fibrillation. Another very common cause is alcohol use. When you're drinking over a weekend or drinking excessive amounts of alcohol, this can bring out atrial fibrillation because alcohol can have a direct toxic effect on the heart itself and result in atrial fibrillation. Last of all, it's just plain bad luck with genetics. If you have a father, mother, brother, sister that developed atrial fibrillation at an early age, there's a good chance that you may develop it as well. There can be a strong genetic link. So reviewed a number of factors: high blood pressure, aging, alcohol use, sleep apnea, and genetics. All of these are important factors. Now there may be other causes as well, and we'll go into them in our future videos. But take care, Mr. Heart. That's it for now. This is Dr. Shantabanso, electrophysiologist. Come visit us on our website at afibamerica.com. Thanks very much for watching.